Hi, I'm Stephen Carson, coming at you from St. Louis, Missouri, in these United States. We're all a bit sick here at the Carson household, so will be a shorter show and a solo show. I also wanted to mention that, let's see. Oh, yeah. Support for the show is gratefully received at Subscribestar. You can find that in the video link, a link for that. And we are near the end of this book on mutual aid. I don't know if I'll cover more on the topic from some other source, but I think there's a little bit more interesting to squeeze out of this. Today, we'll talk about how mutual aid societies built hospitals, sanatoriums, preventative care clinics. So this maybe I thought part of the reason I think this is interesting is it maybe goes beyond what you might picture a little old mutual aid society can do. They were actually able to provide significant services and even build institutions, right? We already previously covered orphanages, for example. Um, all much more difficult to do under our current legal order, which is part of what we want to understand. Let's see. Okay, I think we're ready to go. Let's do it. Hello, everybody. Okay, our dreams have all come true is the name of this chapter. Um, so, fraternal societies even embarked on, what I said, endeavors ranging from state-of-the-art hospitals and sanitariums to preventive health centers staffed by nurses and volunteers. I'm not going to go into it, but there were some challenges with having the life insurance rates that were offered through these fraternal orders. They were not able to keep them as cheap anymore. And so commercial companies were having the edge. So they decided to respond to their roots as fraternal rather than merely cheap rate societies. And so one of their first, a big focus was the fight against tuberculosis. In 1915, for example, in the United States, I assume, 140 deaths per 100,000. They called it the White Plague. It was truly a pandemic. But there was a reason to believe that you could make a difference with this. Evidence was mounting that tuberculosis was curable if detected early. Experts regarded a stay in a sanitarium as a promising form of treatment. They suggested, having improved ventilation, sunshine, a balanced diet, and rest, you could save people's lives. Okay. So, somebody tried to get this going in 1901, 1902, didn't really go anywhere, but it got them thinking about being more ambitious, basically. So for the first time, practical questions of building, financing, and patient eligibility were on the table, and several societies launched their own sanitarium projects, including the WC, the Royal Circle, the Woodmen of the World, and the IOF, the wonderfully named Oddfellow organization. So one of the first groups to do it was the MWA, which opened a sanitarium in Colorado Springs in 1908. The climate of Colorado was considered ideal for treating tuberculosis, dry air, moderate temperatures, that sort of thing. Several religious and ethnic groups had also established sanitariums in Colorado. So they built facilities and grew them rapidly. By 1923, the sanitarium, which covered 1,368 acres, had 205 tent cottages, a two-story central building, greenhouses, a recreation hall, a herd of Holsteins, an elaborate conduit of sewer and steam heat pipes, a barn, a power plant, a library, and a post office. And they had a 4-story hospital of 70 beds with state-of-the-art technology to aid in diagnosis and treatment, not only of tuberculosis, but of incidental troubles as well. Yeah, I should have highlighted this. Oops. Yeah. So what was the deal? So if you were a member of the MWA, insured through the MWA, you would be admitted to the sanitarium if if you needed this, had tuberculosis. And everything was free except travel expenses, getting yourself to it, and personal incidentals. Um, and so actually, they had quite a lot of people asking to go, more than they could take initially. Um, Now, by 1945, the death rate, what was that original death rate? That was in 1915. So 30 years later, the death rate per 100,000 had fallen to about 40 from 140. Uh, there's not agreement on why that was. This was an overall improvement, right? Um, and uh, yeah, anyway, that people were getting less tuberculosis in the United States for whatever reason over that time. So that helped ease off the pressure on the use of the facilities. So the sanitarium complemented the older fraternal conception of benefits as reciprocal obligations. The services were not given in charity, but in fulfillment of the society's contract with all its beneficial members. Remember the sort of a self-concept thing. It was very important that they were not pitching themselves as charity because many people viewed that as demeaning to receive charity. The idea is, hey, I, along with many of my fellows, have paid my dues, done various things to be part of this organization. And this is just one of the benefits of being part of this organization to which we've all contributed. It's not a charity thing, you know. So that was sort of an important framing for it, I guess. At the same time, each patient that came to their facility here was subject to a certain degree of discipline. If he failed to subscribe to reasonable rules for his own good, there is another neighbor, another member, on the waiting list ready to take his place. I try to highlight throughout this series. I've tried to highlight, the exclusivity, the rigor in what is expected of people, and that's because I think that that was an important part of how all this mutual aid stuff worked, is that they had benefits to they had it wasn't a free for all. It's the where's my main mind gone blank? The commons. Yeah, they solved the tragedy of the commons by not just throwing it open to anybody. You had to have skin in the game through dues and other contributions to the organization, and you should be responsible and not cheating, getting benefits that didn't, you know, really make sense. Like, you were lazy and didn't feel like working. And so you tried to get some kind of unemployment benefits from the organization or something. They tried to really police that. Anyway, they had fairly impressive results. The MWA Sanitarium admitted advanced cases of tuberculosis, about 30 to 50% of the total people who came to the sanitarium. And so their numbers, which were, let's see, by the end of 1925, 4.5% had died while at the sanitarium, 50% still survived. And that compared favorably to other sanitariums. In the others, 25% of patients in the U.S. died in an institution, and about 50% more died within 5 years of release. So this MWA sanitarium did a fairly good job. Okay, so but fraternal organizations tried other ambitious healthcare, did some other ambitious healthcare building. Some societies began to consider comprehensive programs of hospitalization. some of them, as we covered before, the episode about doctors, they had this lodge practice, which the American Medical Association type of organizations really hated, but basically the lodge would contract with individual doctors and was able to provide really affordable care for their members by basically hiring a doctor on to be the one for the members. And so some of these organizations, like the Odd Fellows and the WC, I'm forgetting what WC stands for, they already had existing systems of lodge practice, and they sort of grew into offering more and more medical services through the society, right? Let's see. So, let's see, we're talking about the WC here. Yeah, so they started to grow their services, opening citywide medical departments. In 1920, the medical department took the next step of establishing a specialist service with doctors in fields such as surgery, obstetrics, dentistry, optometry, and orthopedics. And a member could consult a specialist upon obtaining a referral from a district doctor, so one of the lodge doctors, right? They would contract with private hospitals for rooms and hire salaried surgeons to perform operations. So, basically they're offering more and more services to their members, getting more and more into like running a full-on, not just paying people so that they can get medical services, but providing the medical services themselves, managing it themselves. So the WBA, pictured as the thumbnail, the hospital we were going to talk about is pictured as the thumbnail for this episode. WBA got really ambitious. Though it went a little bit different than these other things. The WBA did not have the lodge practice with the individual doctors. The main benefit they offered their members was life insurance paid through the national organization. But people were wanting to have broader services from this organization. And they're, by the way, the terminology of these fraternal organizations is always great fun. They're called hives, the local chapters or whatever, right? So several local and state hives decided on their own to establish medical services. So in locations as diverse as Chicago, Illinois, Birmingham, Alabama, and Yankton, South Dakota, they endowed rooms and beds for members in hospitals and sanitariums, similar to what the WC had been doing. Eventually, the Supreme Hive Review, the national office, wanted to bring the service to the entire membership. And so they would disperse receipts to state and local hospital committees of volunteers, who in turn contracted with private hospitals to reserve or endow beds and rooms. So then, let's see. I'm not going to go down that rabbit hole. Sort of the benefits to doctors who would work with these organizations. Right. So the next step the WBA took as they grew into this is that they began to focus on prevention of disease through the establishment of local health centers. So this would be preventative health, right? They had opened 36 centers by 1931. So at no cost, any member of the WBA could obtain a general physical survey, such as the taking of temperature, weight and measurements, pulse and blood pressure, examination of eyes, ears, nose, throat, and teeth, and urinalysis. Let's see. And then sorry for some background noise that I'm sure is getting picked up. I'm located right next to one of our laundry facility things on the Carson campus here. So this really became quite a nice service. From 1923 to 1934, members had the benefit of 902,000 health center consultations. and 28,000 examinations by doctors. I highlighted that just to show this was operating on quite a large scale, helping a lot of people. Now, moving to the building of hospitals, right? This is all leading up to, they're just going to full out provide hospitals. The first fraternal hospitals were built on an ethnic basis. So the oldest and longest lived were those of the French and German mutual benefit societies in San Francisco and Los Angeles. El Centro Asturiano and El Centro Español supported 2 early 20th century hospitals. These were extensions of cooperative clubs or centros, which had arisen in Cuba during the late 19th century. And they provided financial mutual aid and operated clubhouses. So, hopefully it's not getting too confusing. French and German societies, and then these Cuban societies, right? They're all opening hospitals. The first of Tampa's fraternal hospitals opened in 95 under the auspices of El Centro Asturiano. The hospital boasted ultimately 60 beds, a pharmacy, an up-to-date operating room, an x-ray laboratory. Some historians reckon that it ranked among the most modern and best equipped in Florida. This is fun for me, by the way, because I was born in South Florida and didn't grow up there, but often went back to visit my grandparents in Miami and Naples, which is south of Tampa. Once they opened these hospitals, they wanted to make sure they were keeping them busy enough. So they added members who were from different ethnic and cultural groups. The only restrictions of the Tampa El Centro Asturiana, the one in Tampa, was that the initiates be white and of good character and in good health. Within a few years, native white Floridians who wanted low-cost hospital care began to apply. By 1942, so many persons had joined the group that perhaps 20% of the members were of Anglo-Saxon stock. That is, they were expanding beyond their original Cuban membership and getting into, the Anglos. Okay, back to the SBA. So during the 1920s, the SBA established what became probably the largest of the fraternal hospitals. It is not what is pictured. That's the Tampa hospital on the screen right now. We'll see the other one in a moment. Let's see. So no life insurance order had ever established a general hospital. So this was a first. I'm not going to cover this, but throughout this, and I'm kind of skipping over it, he gets into exactly how they financed it, through member contributions or special one-time, getting people to you get your name on something if you contribute, So it gets into those details, which might be of interest if you decide to do a project like this yourself. But I'm going to skip over a little bit of the financing details. So the hospital rapidly surpassed the orphanage and the old folks' home as the crown jewel of the SBA. The hospital was an imposing edifice with 3 stories, 40 beds, an x-ray machine, and 2 operating rooms. They added an eye, ear, nose, and throat specialist, nurses, lab technician, dietitian, paid their people well. The cost to members was free as long as they kept up their life insurance payments. So as long as you continued to be a regular member, then you could just use the hospital. The SBA's medical plan specialized in dealing with major medical expenses, or in modern parlance, catastrophic coverage. Okay, so let's see. What else did I want to highlight here? Oh yeah, this is fun. So they published some of the letters from satisfied patients. This is where the title of the chapter comes from. Since I have come home from that wonderful SBA hospital, wrote one member in March 1926, I often might find myself wondering if it isn't all a dream that there's really such a fine place for the service of those who really need it. So that gives us our chapter title, right? Which is Our Dreams Have All Come True. Many patients commented on the home-like atmosphere. Gus Lading of Topeka wrote that the patients were like one family who visit one another and see how everybody is getting along, so you cannot get lonesome there. I personally, not to sound too squishy about this stuff, but I personally think this is a significant issue. People are social animals, and you often hear complaints that going to the hospital feels very cold, lonely, and in babies, as we know, there's the issue of failure to thrive when they're fed and they're changed, but they're not touched. I think adults can survive without that, right? But I think your best health outcomes probably involve feeling supported and connected, right? So not entirely unimportant things they're highlighting. Okay, and then they decided to increase the size of the hospital, and this ended up maybe not being the best decision in the long run, but it seemed like a good decision at the time because they were having quite a bit of growth in the use of the hospital and everything. The guy who came up with it had an ambitious plan. He wanted the hospital to surpass in magnitude the great Mayo Brothers Clinic. I think the Mayo Clinic is still around. So the expanded hospital opened in 1930, was nothing like the Mayo Clinic, but it was still something to brag about. It was modeled after Independence Hall in Philadelphia. You can kind of tell if you look at that picture there with the clock tower, the rising above. Had 250 beds, 2 extensive wings, 160-foot clock tower in the middle. Cost about $800,000 in 1930. That's a lot of money in 1930. It was probably the largest general hospital ever built by a fraternal society and one of the best in Kansas, located in Topeka, Kansas. So the issue was that they were going right into the Depression, right? They opened it right when the Depression started. So this became a challenge. And they had to start charging people room rates and stuff like that, not just giving it all away for free. But they were still able to offer a better deal. A study of 10,000 full-pay patients in 100 private hospitals found that the average patient paid $72 for a stay of 11 days. The equivalent stay at the SBA hospital cost $21. Excuse me. Okay, hopefully I messed with my volume accidentally. Hopefully that's all right. Okay, let's see. Okay. So they did weather the economic storms of depression rather well. I think there's a good lesson right here on the financial side. Throughout the crisis, the hospital continued to pay all claims and paid all claims, kept debt to a minimum, and much of the credit lay with the conservative financial management during the 1920s. They had generally avoided the temptation to finance expansion through borrowing. So they did have a big expansion, but they didn't borrow money to do it, right? It came primarily from voluntary contributions. So they were paying as they went. This aberrance of debt, which was a characteristic of other societies as well, was a natural reaction to years of bad experience with overexpansion and cheap rates. So that, we covered it before, but fraternal societies got a little ambitious and they started to have some problems. The fees they had members pay were not covering all the things they were trying to do. And so they started to get more conservative, make sure they had enough money before they launched new projects, rather than getting into debt. That seems very wise in my view. So the hospital was a huge success, really got used. Clearly, Americans wanted far more from a fraternal society than life insurance. But they started to have some big problems. So they faced some obstacles. Here's one: opposition from organized medicine. Doctors and hospital administrators looked suspiciously on the SBA hospital as an expanded version of the old lodge practice evil. That's what the AMA labeled it, I think. At various times, the three doctors on the SBA staff had difficulty gaining admission to professional organizations such as the American College of Surgeons. So they'd try to blackball them, right? The SBA hospital had trouble winning a place on the approved lists of medical, surgical, and hospital associations. Another threat, and this is really where I've read lengthy articles on this, what we're about to cover. This is where the U.S. medical system really got messed up and has an undeserved reputation as being, really free market compared to the NHS. Maybe it is free market compared to the NHS, but it is not free market. The American medical situation is quite terrible from my point of view. So what happened? So a threat to what the SBA was doing arose from the rapid spread of employer-based third-party payment systems of healthcare. Blue Cross and Blue Shield were examples, and these are still around. The purpose of Blue Cross was to pay hospital expenses. It had been formed in the 30s by hospitals, note, not by patients, to achieve a larger and more stable source of income from patients. The goal of Blue Shield, an offshoot of Blue Cross, was to provide cash compensation of physicians. Most subscribers to Blue Cross and Blue Shield did not join as individuals, as was the case with the SBA, but were enrolled in groups by their employers. This is how it is now involved. It's not just you and the person you're getting the service from or the outfit you're getting the service from, the doctor or the hospital. Now you've got this insurance company and third party. There's like four parties involved, right? There's your employer. There's the insurance company your employer contracts with. There's you, and there's the medical provider. This ends up causing a lot of expenses and perverse incentives. Okay, so where was I? Okay, right. So this didn't, as we know, this wasn't just spontaneous. Changes to the federal tax code greatly spurred the growth of these plans. The Revenue Act of 1942, note that this is during World War II, was especially important because it exempted fringe benefits such as health insurance from the income tax. The act opened the door for employers to compete for workers during a period of wage controls. So, two bits of government intervention here causing distortion in the market: the income tax and then wartime wage controls. And so companies would start competing by saying, hey, we can't pay you more because the government has prevented us from offering you more money. But if you come work for us, we'll give you that fixed wage that the government has established, but we'll also give you health insurance benefits and other stuff. And the tax code allowed this to be snuck through. The result of this, as I said, is that the whole country is now pretty much on this. The war is over, the wage controls are over, and we still get our medical benefits mostly from our employers, which I think is the source of a lot of trouble. So what was the result of all this? Members of groups such as the SBA were the losers because they had purchased policies on an individual rather than a group basis. They could not deduct their dues from their taxable income. Okay. The spread of free, quote, free health insurance coverage meant an ever shrinking market for the SBA product. By 1946, number of subscribers to Blue Cross had risen to approximately 20 million. Let's see. And then also there was an upward spiral in healthcare costs during the 1940s. This also was contributed to the demise of the SBA hospital. Inflation forced hospitals to pay more for medication, building supplies, and technology. Wartime conditions, including a shortage of doctors, exerted tremendous upward pressure on salaries and led to rapid staff turnover. Also, another thing that the SBA in general suffered from was that the old fraternal ties seemed to have waned considerably since the 1920s. And so they started to think about just turning the SBA into a commercial company, and in fact, that's what happened. The board of directors concluded that the fraternal method of operation was no longer viable and started conversion to a mutual company. The process was complete by 1950. The Security Benefit Association formally became the Security Benefit Life Company. And then the hospital they had started closed for good in 1954. So, short show here, but I hope this is of some interest. I think we should try to get the fraternal societies going again. We have at least one project I know of in the US where we're working on this, and other projects in other countries. Obviously, one of the problems is we're up against a lot of legal hurdles that the, say, 19th century fraternal societies were not facing. There's a lot more regulation, a lot more barriers to entry into providing medical service, providing insurance, all this stuff, right? So it's legally more complicated, and probably have to have a lot of lawyers to pull it off. It's just the reality. But and then the other, so I want us to have some ambition as we think about mutual aid and what mutual aid can do. We don't need to think small necessarily. We can see how much they were able to accomplish in the past, and especially with a lot of dissatisfaction with the welfare state and with the medical system, which has become very expensive, makes people feel very tied to their job, right? And well, I'd like to quit, but I wouldn't have health insurance, that kind of thing is a real problem. And sorry, I'm distracted because I am getting some drop frames, unfortunately, right now. Hopefully the audio is coming through okay. So the 1940s and 50s witnessed the end of the second wave of fraternal healthcare expansion. The rise of third-party insurance began to invade markets traditionally served by fraternal alternatives such as the Oddfellows, the WC, the WBA. There were exceptions. The Centros of Tampa and the French Hospital of the French Mutual Benefit Society of San Francisco remained open until the 1980s, although there was a growing tendency to cater to third-party payers rather than members. And then I'm not going to cover this next chapter, but just in case you're interested, there were also examples of fraternal expansion in hospital care during the post-war period, after World War II. And two of the most impressive were some black hospitals in the little town of Mound Bayou, Mississippi, a very poor black community in Mississippi. And that's what this chapter covers. But in the, what I'm going to do is I'm going to wrap this up next time I do this, which is probably 2 weeks from today. There's two last chapters in the book. I think that's where we're going to get to more of sort of how it all died, the end of the golden age, and the final chapter is called Vanishing Fraternalism with a question mark. So, we're going to see how this all died. What were the forces that contributed to it? We saw some of that today. And then think about prospects for bringing fraternalism back, mutual aid societies back. Yes, thanks. Yes, thank you. Fortunately, I've gotten off pretty easy. Here, let me switch view here. I've gotten off pretty easy. I'm just sniffly and got a cold. It's not fun, but it's no big deal. My wife had a really rough week last week, and she is still working on coming out of it. So it's been harder for her, and then all the kids have been sick to more or less of a degree, though my wife got the worst of it. Anyway, every fall, winter, our whole family, things go through our whole family just about. So we're used to it. Anyway, thank you, everybody. Let me just see if anyone had super chat type things real quick. Just double check. Okay, I don't think so. Okay, good. Yeah, so next week, if you didn't catch last week's, I really recommend it if you're going to tune in for next week's Econ Minis. Black Horse laid out the case for Biden. How do you say it? Bidenomics. Yeah, for Biden's economic performance to actually have been pretty good, at least by the standard measures. Um, and the only problem being that nobody's, they're delivering line go up on GDP and line go down on unemployment and so forth. It's all the indicators that should make Biden like a sure thing for the election later this year. And nobody's happy. It's not working. If you've seen the polling, Trump is very heavily favored at this point to beat Biden. If they don't find some way in which they're trying to of preventing him from being on the ballot. And so the mystery that we'll start to look into next week is how is it that all this good, good economic policy is not resulting in political capital for Biden's administration. So that will be interesting to dig into. Okay, thanks everybody. And I think the credits have been working, which I'm real proud of. I need to double check, make sure I've got my contributors right, but just want to call your attention as the credits roll. I do list subscribers, often pseudonyms or anonymous, but they know who they are, and really appreciate those who support the show. It's been great. Some rising costs of my own to continue to pay my graphic designer and so forth. So thank you very much.